effective.
So we've been preparing for the vaccine since the last several months.
Wesley Wells, pharmacy director for Covenant Health, says they want to be ahead of the game, making sure they have the right storage and team to get the vaccine to patients.
Because it's going to take a little bit more coordination than what you would normally do with like a flu vaccine.
The Pfizer vaccine must be kept at negative 94 degrees Fahrenheit. Wells says they have an ultra-cold freezer they'll be able to keep the vaccine in.
The state is planning that the Pfizer vaccine can be maintained using dry ice for a certain period of time. And so there's a couple options there.
The Moderna vaccine can be kept at the standard temperature as other vaccinations. It can also stay in the fridge for up to 30 days, while the Pfizer vaccine has a shelf life of 5.
Just need to make sure that we have good refrigerators in everywhere, so that way we can make sure we can distribute it the way we need to.
Getting the vaccine to rural hospitals like those in Loveland and Plainview is still up in the air as well. But 2 models may be in the works.
One is kind of a hub and spoke where you would send it to a central location and then allow them to distribute that. The other idea that the states have is to distribute it to the sites where it's being given. They don't want it moving around or anything like that.
But Wells says with so much constantly changing, it's important to remain cognizant.
The information we have today, just like with everything with COVID, may be different than what tomorrow has in store. So continue to try stay ahead of it, but also stay flexible.
Both Pfizer and Moderna are planning to file to have their vaccines available for emergency use. And if the Food and Drug Administration approves, they expect the vaccine to be available to frontline workers and the most vulnerable as soon as December. Pfizer also announced Monday Texas will be one of 4 states involved in a pilot program to help refine a plan for the delivery and deployment of the vaccine. Olivia?